Joanne Haigh. We welcome our viewers and listeners in Barbados and around the world to another edition of Face It and Fix It on CBC TV 8, CBC Barbados, Facebook and YouTube, and of course Q100.7 FM radio. Now, what's on my mind this morning? I just want to take us back to last Thursday's show. We had a young lady who made a plea for some assistance for her 3 children to find a house. She was being evicted, apparently, threatened to be evicted, I should say, over the weekend. Thank God that did not happen because some individuals came to her rescue, and I want to publicly thank them without calling out their names. But Catherine, the homeowner, has offered to rent her home at a reasonable price. And the other lady who called us, I can only refer to her as Angel Amory. I know you're watching, you don't want us to call out your entire name, but Amory actually offered to pay 1 year's rent for this young lady and her 3 children. And this only shows me that despite all that is happening around the world, that there's still a lot of good left in the world. So I want to publicly thank those individuals for coming to the aid of the young lady, 39 years old with 3 children. You now have a home, thanks to Catherine and Angel Amory. Now, today we are going to focus on COVID-19 a little bit more. The pandemic, as you know, there's a worrying surge. And to help us discuss that with the vaccination rollout is Dr. Elizabeth Ferdinand, coordinator of the National COVID-19 Vaccination Campaign. And she will update us on the vaccine rollout for our children. In addition, we also have Dr. Brian Charles. He will also look at the children in Barbados and around the world and the increasing cases of COVID-19 amongst younger persons under the age of 18. We also have PRO of the Barbados Association of Medical Practitioners, Dr. Russell Broome-Webster, and he shares concerns about having to lock down and what we should do and how they see it from their perspective as doctors. And we also know that food prices are going up through the roof, and we want to talk about how has the pandemic affected the agricultural sector, and who best to discuss this? None other than Minister of Agriculture and Food Security, the Honorable Indar Weir, will bring some clarity to this. Now, we want to hear from you on these topics or any other topics that you want to talk about. The number to call, 228-5563 or 228-5562. If you want to send us a WhatsApp message, it's 228-5562, or join us on Facebook. Send us a comment there. Find us on CBC Barbados on our Facebook page. When we come back, we will be speaking to Dr. Ferdinand. Welcome back to Face It and Fix It. We are joined now by Dr. Elizabeth Ferdinand. She is coordinator of the National COVID-19 Vaccination Campaign. She's no stranger to the show. We had her on a couple of weeks ago, so welcome back, Dr. Ferdinand.
Thank you very much, and good morning to you and to our listeners.
Always a pleasure to see you because when I see you, I know that we have vaccines on the island. We know that the program has started back, and we know we have a variety. But we want to ask you, because the last time we spoke about AstraZeneca and Sinopharm, let's talk about Pfizer and the difference now of this particular vaccine versus the other vaccines.
Well, this vaccine is what we call an mRNA vaccine, which has it was made in a different way and it has a different structure. That is the vaccine that has been approved for use in children between the ages of 12 and 18. Before, we could only give adults over 18. But now we have another arsenal. We can use this Pfizer between 12 and 18. We were lucky in having a donation of this vaccine from the USA government. President Biden and the White House were very much involved in negotiating to give us this vaccine, and Barbados is very grateful to have received Pfizer because we were not able to get it before.
So we now know that Pfizer has full backing of the Food Drug Administration, FDA, full approval for adults and for children as well.
Yes,
If parents now
yes,
would
that
say
is
to
correct.
you that they're a little skeptical about this vaccine, what assurance can you give them that it's safe for their children to use? Bearing in mind it was not on the cards yet for children, but now that it's FDA approved, give them a sense of what it had to go through so that it now reaches the stage that is safe to use for our children.
Okay. Well, first of all, I think let me take a little step back and say that any vaccine, any drug, any new device has to have trials. They have to go through a time period of trials. Usually, you will start with a few people in a group being given the drug or the vaccine and see what the outcome is. It safe? Then you're going to enlarge the group to hundreds instead of just a few tens or twenties, and you do trials again, and you look at how effective is it. And then after that is proved effective and safe, you move into a much larger trial of several thousands of people. Now, in the case of these vaccines that we're using, all of them were approved by the WHO for use under emergency situations. The Pfizer was the only vaccine that has gone through the trials in younger people, children, for example, between 12 and 18. You see that we cannot give children under 12 because there's not been enough trials to see whether it is safe and effective for that age group. So we have to wait until trials are done on probably Pfizer, probably some other vaccine to see whether we can then use it in younger children under 12. But right now, we can only do 12 and up, including adults, of course. So, like AstraZeneca, the Sinopharm, they have not really been tested or tried in younger people. So that is why they have not been approved, and so we cannot give them to younger people.
How long have we started the rollout for children under the ages of 18? Because I want to ask you if we've had enough data from Barbados and even around the world about the side effects, some adverse reactions for this particular vaccine that you might want to share with us?
Well, let us say we in Barbados only started our rollout last week. So we started officially on Friday. We did do a few preliminary groups on the Thursday, but Friday we started. And of course, we've been going full steam every day since then. We have changed our usual rollout a little bit because of several reasons. First of all, we're using a new vaccine which we've never used before. And I can go into that in a bit more detail about why is it different. Secondly, we have moved into more schools. When we first started in February, we were using a few schools, but that was when we had the lockdown and the schools were all shut. But we had to move from the schools and look for other more permanent sites because school started as a face-to-face operation. So after we had got these permanent sites, for example, like the Sandals Conference Room, building number 2 in the Harbour Road, several other places, we were comfortable there and we found the crowds were coming. So we didn't go to the schools. But now we're in holidays. Schools are proposing to come back into face-to-face later on in September. And so we have two challenges. One, we can use the schools until then. And two, we want to get as many children as possible, even if it's only the first dose, to get their first dose of Pfizer. It is a 2-dose schedule where they're going to have the first dose, and then 4 weeks later, they will have their second dose. It has proven to be safe in children. As with anything, I mean, even aspirin, Panadol, some people are allergic to different foods, sometimes the ingredients in foods. There's always going to be a person or two who have a reaction or who has a reaction to this particular vaccine or anything else. The usual, like a sore arm, fever, maybe a little headache. Those are the regular things that are expected to occur, and I would not be surprised if many people report that. That's the usual thing with the vaccine. But there are some serious side effects, yes, 1 in a million, but I can't tell you who that one is going to be. And I don't know if that one would be in Barbados. But there are some cases where you can get an inflammation of the around the heart, which is called a pericarditis, and that usually has not been fatal in many cases, but it is of concern and it has to be treated by the hospital. And that will occur after 5 days after the vaccine, several days after the vaccine, not immediately. But I don't want to alarm you. You asked me for the side effects and I've given you, but as I said, they're very rare and there's been millions, billions of people given this vaccine over the world. Just taking USA, for example, millions have been taken it, and it's a very small number of persons who get ill from it.
Well, let me just ask for a friend who reached out to me yesterday about her daughter who's turning 20, well, she's 25 today. Happy birthday to Shanice. Shanice is an asthmatic, pretty bad asthmatic, and she wants to take the vaccine, but she's not sure. Could you assure her and other asthmatics about the importance of taking this vaccine? Because I believe some people feel because you have asthma, you shouldn't take it, but it's quite the opposite.
Yes. It's quite the opposite. Just this morning, someone called me to ask if their child, who is a sickle cell child, could have it. I said yes. So people who have chronic conditions, asthmatics, sickle cell people, cancer patients, all of these patients, including those who have non-communicable diseases like diabetes and hypertension, they are the prime ones who should have it, right? We have some youngsters who we could not have given the AstraZeneca to when we first got it, but they were in those categories of high risk. And yes, if you are an asthmatic, you must go and get the vaccine. You can have a choice. You can have either one of the 3 that we now have. We have AstraZeneca, which we had before. We have Sinopharm, and we have now Pfizer. And if you're 25 years old, you can have the choice of any of the 3. Unfortunately, as I said before, if you're under 18, I can only give you Pfizer.
Well, good. So you heard that, Shanice. If you're watching, Dr. Ferdinand has advised you today. Give yourself a gift and go on and get vaccinated. I want to ask you, though, about the storage of Pfizer and how difficult has it been to move it around, mix it, administer it versus the other two vaccines and store it.
At first, yeah. At first, I was a little nervous about getting it because we've never dealt with a vaccine at minus 80 degrees. And although you read and you listen to videos and webinars and so, it's only until you actually have it and you're using it that you understand. Well, first of all, we had to find storage. Where in Barbados can we store vaccine at minus 80? So we were fortunate that we got ample storage, so that is not a problem. How was it going to arrive, and what were the procedures that we had to take when it arrives to get it from the traveling pack, the travel frozen pack that it came in, into these freezers? And we managed it very well. Of course, it came to the facility. We had to use thermal gloves, the special gloves, because it's so cold. It's steaming. You could call it steaming. And then it was surrounded by dry ice. And as you open the packet, of course, the dry ice starts to disintegrate and fumes come up. So you have to wear goggles over your eyes too to make sure that none of that steam or freezing steam gets onto your cornea. So the person who is dealing with it at the frozen end we had to take it out and then put it into the freezer and check the temperatures and what's not. We had to do that within 3 minutes of it arriving. When I say arriving, sorry, from us opening up the box and taking it out.
Wow.
That went smoothly. We didn't have a problem at all. The nurses are very knowledgeable, and there were about 4 or 5 of us supervising that, and it went smoothly. The temperature we didn't have any problem. So now it's in storage. It's fine. That can last until the end of the expiry date. However, how are we going to get it to the clinics? How are we going to get it to the schools or wherever we're doing it? We have to transport it in a cooler, but we don't have to transport it at minus 80. There's 2 ways. You either transfer it at minus 20 or you transfer it at what we call 2 to 8 degrees, which is the normal temperature inside of a fridge, a very working fridge. So we jumped from minus 80 through the thawing process of using the 2 to 8, which is the fridge. So all the clinics and the coolers that we have with cool packs in it are capable of keeping the vaccine at 2 to 8 degrees. So that's the temperature part of it. The third part was the actual diluting it. The other vaccines came already constituted in a vial, so you just have to suck out the 10 or 5 or whatever number of vials you're allowed to do. But in this case, we have to take what we call the diluent. We take that out of one vial, and then we have to insert it into the vial that has the vaccine. And we gently shake it, just an ordinary little shake like that 10 times, so that it's mixed nice and gently. And it is from that vial that we're going to extract 6 doses. So each vial gives us 6 doses. So it was different, but once you learn the process, it's very simple.
You guys got the hang of it.
It takes more time.
It sure sounds like you did, but before our time goes, people want to know, if they want a vaccine, where can they go to get a vaccine? And we're seeing from before a lot of long lines, which could turn off people, because I know some people just said, forget about that. I'm not standing up in this line in this hot sun. What are we doing to rectify that problem?
Okay, let me start with the last question first. We are trying our best. I really promise you, we're trying to get more sites. We're trying to take it to the people into their communities, and we're really trying with the long lines. In some sites, it's impossible to have everybody inside. So there are some lines outside, I'm afraid. But we're really trying. We have challenges. It's like everything. Even after all this time, we still have challenges. Our IT system is sometimes the carrier, whatever you call it, is slow. We can't get on. It takes time. And if you take longer with each single file that you have, or each single card, it prolongs the thing and keeps back the process. And that is our biggest challenge because first of all, we had a human resource problem, and PM has helped us, given us more staff, more volunteers, but it is mainly the IT. And then, but we're trying with that.
It can
We're
become
trying.
frustrating so quickly. Where exactly can we go now today
Okay,
if we want a
so
vaccine tomorrow?
today you can go to Harrison College, St. Leonard's School, Princess Margaret, Christchurch, Parish Church Hall, the open campus at the Pine. You can go to Lester Vaughan Secondary School and Alexandra School. Those are geared mainly for the children and their parents. But parents, single people can go. Other than that, adults only can go to building number 2 Harbor Road or the Eunice Gibson Polyclinic. That's today.
So
And
if
during the week,
go on,
most
go on. Hmm.
most of those sites will be open during the week. The same sites will be open during the week.
So as a
And it's
parent, let's just say I'm
usually
taking my child and I need a vaccine too as a parent. You're not going to say I'm going to vaccinate your child at the school and then you go to the building. You're going to do the family.
no. The parent is offered. The parent is also offered to have vaccine at the same time as the
Good.
child.
Okay.
Right.
Well, thank you so much. We're a little out of time, but I want to thank you. God bless you and all of your colleagues for the work that you do. I know it has not been easy, and you smile right through it somehow or the other when you come on TV. So God bless
Well,
you,
I
Dr.
love you.
Ferdinand. God bless you.
Okay, thank you very much.
And I hope more people come forward to take this vaccination so we can get back to some level of normalcy. Thank you so much for joining
Okay,
us
thank you
again.
very much.
I know we'll see you again soon. Thank you.
All right, bye-bye.
When we come back, we're going to speak to Dr. Brian Charles and, of course, continue the conversation about vaccines and our children and the numbers that we're seeing at Harrison's Point when we come back. Welcome back to Face It and Fix It. Our next guest is a familiar face. He probably comes on now once a week, and we want to thank him for taking the time to do this. None other than Dr. Brian Charles, specialist emergency physician. He's joining us. I believe he may be back in Barbados. Not sure. No?
Hoping
Oh dear, no such luck.
Good morning, all.
Thank you for joining us again, Dr. Charles. Now, we do have some concerns now because we're hearing about more and more children catching this Delta virus, this COVID virus, the Delta variant. What's so special about this Delta that it likes to cling on to our younger people?
Yes, it's very unfortunate, and it's one of the results of the virus mutating. The virus has changed. I don't want to use the word mutating. Let's use very simple language. The virus has changed, and this is what viruses do. They change either to get stronger, and sometimes they change and get weaker and die out. But this Delta variant now has changed, and it is now and spread more rapidly. And previously, the original Wuhan virus and then the Alpha variant would you get one person who caught that would spread it to three people. This Delta variant, one person who catches the Delta variant spreads it to between 9 and 12 people. So it's very. The second thing is that previously in the original strains, we were concentrating on those persons who were high risk, and that is the elderly, so persons over 60, persons with non-communicable diseases, persons who were immunocompromised, who could not fight the infection very well. Well, very many of those people have been vaccinated and now can mount a more robust fight against the Delta variant itself. Now, because of that, and because of the rapid spread of the Delta variant, more younger people, including children, getting infected. And as they get infected, a certain proportion of them will get severe illness and need hospitalization and ICU treatment. And it is because of this that we're seeing the younger population now being more vulnerable. So remember, uh, very early up this year, starting to immunize or vaccinate those persons who are likely to get severe illness, that is the elderly. Those people have now been, by and large, not all, but a significant proportion of them have been vaccinated. Those who were unvaccinated at that time, so the younger population, they are now exposed to a more virulent virus. And hence, they are now the ones that are getting very sick. And that's the reason why we're seeing a change in the landscape. I must say, before we even go on, I have to say that it saddened me the day before yesterday to learn of the passing of one of our society, a young lady. I don't think 58 or 57 years old
55, I
is
think she
very
was
old.
55.
55, even so, yeah, 55, who has had no comorbid illnesses and was not, in the. And my condolences go out to the family and the friends and the loved ones of this lady. But this is how the virus goes, and some people will get severely ill. Previously, it was that 2 to 5% who had non-communicable diseases, but now the landscape is changing over to the younger population. As we see with this young lady, the younger population now can get ill. So this is changing entirely what we, the medical fraternity, have to deal with.
So with the Delta variant, before with the Alpha and the other variants, it was more about the lungs people were talking about. But with Delta, are we seeing this attacking other organs in the body?
So the SARS-CoV-2, all of them and it can attack any organ in the body. Whichever organ it chooses, we don't know. But it first starts in the respiratory system. So you will get, I mean, we all know that when we do the swabs for the testing, we do a swab down your nose, it goes to the back of your throat, because that's where the virus houses itself at first. That's where it takes up residence. It then spreads down into the lungs, and that is where it starts to wreak havoc. So persons will primarily start to get pneumonias and then clotting issues within their pulmonary system. That is the system that is used to breathe. Because of this now, then other inflammatory mediators are released into the body, and these together with viral particles then go to different organs. So you would have heard that the virus and the COVID spreads to the heart. It has brain effects. It goes to your kidneys. It has gastrointestinal effects. Some people just present with a rash, so skin effects. Can affect every organ of the body. And as Dr. Ferdinand was saying just a little while ago, we don't know who or where it is going to affect. And that is the reason, that's what makes this so interesting and so perplexing to treat because we just don't know. And the mechanisms that we have at this point in time to fight against the virus. And as you know, and we've said this, you've said this quite well, the non-pharmacological methods of sanitization, washing hands frequently, staying physically distanced, avoiding crowds. It's very important to do this. But now we have a thing that really is going to help, which is the vaccination. And the vaccinations prevent the likelihood of severe illness, hospitalization, and death. So those are the things that we need to do against the entire.
And that's something we need to repeat, that when you're vaccinated, it reduces illness and death, and reduces it significantly. No one can say 100% because nothing is 100%. But one of the things someone said to me this morning, there's an individual here that caught COVID around January, got vaccinated, and got it again. Now, but they're fine. They were actually shocked that they actually have COVID. Actually, when the first time they had it, nothing. They got the vaccine, but is it that you can catch another variant to this? So, because some people want to know if you can catch it a second time. So it's not really a second time in a sense. It could be, it's another variant that the body picks up.
So let us be very clear on this. You can actually catch COVID more than once, even with the same variant. But it is less likely if you've had a previous exposure and have been COVID positive. It is very unlikely for you to get the infection again, but it is possible. It is possible. The second thing is, as we allow the virus to change within the community and it changes into the new variants, we can catch these new variants as well. So you can have the original COVID, you can get another variant, and you can catch that as well. Being vaccinated protects you not from catching the disease. So please, Barbados, remember that getting the vaccination does not prevent you from getting COVID. It is from becoming severely ill and needing hospitalization and likelihood of death. Now, as time goes on, once you're vaccinated, the protection that your immune system has against COVID decreases. So 9 months, and this is why we've heard that Pfizer now has said we need booster shots, because after a while, the amount of protection that your body has against COVID decreases. So it is likely that you need a booster shot to make you more robustly able to fight an infection or a reinfection. Now, these booster shots, we don't know, and at this point in time, where it is for AstraZeneca or for
I was about to ask,
which we have. Yes, we do know for Pfizer that it is advised that a booster shot should be given. We're not sure when, but the nice thing is that because it has full FDA approval, and I repeat, full FDA approval, it is not for emergency use authorization anymore. This is the Pfizer. We can administer whenever we believe that the booster shot is needed and that your immunity is waning. So it's important to realize that being vaccinated, Joanne, just as you said, you can get it again, and you may not get any symptoms because you are vaccinated. The unvaccinated persons are still going to be exposed and likely to get severe illness because they don't have that level of protection.
The AstraZeneca, though, that we know, we haven't heard anything that if we're going to need a booster, does that mean that obviously they're collecting data from all of the various vaccines to see how long it would last in your body? So we do have data to suggest that the AstraZeneca, which is different makeup of a vaccine than the Pfizer, we know the Pfizer needs a booster. Could we be so lucky, AstraZeneca takers like myself, that we may not need a booster? Or that seems to be more heading in that direction?
I will tell you that at this point in time, we have not seen, we don't have the evidence to say that the immunity is waning as much. but that doesn't mean that we are not going to need a booster in some point in time. And there are two reasons for that. The first one is the one I just spoke of, which is the waning immunity against the previous virus. But secondly, as more variants come into play, the human body is the host of the virus. As we allow the virus to spread more and more, the more likely it is that it will new variant. When these new variants do occur, if the protection given by the vaccine against these new variants are no longer effective, then a booster shot is going to be needed. So in the future, I will not be at all surprised that if we need booster shots for all these
For all
these
the
vaccines.
vaccines. Okay.
Yes,
Which
that's
which
correct.
I
And to be
believe
honest,
that.
Joanne, I will tell you that I am relatively confident that coronavirus is not going to go away now, because we have unfortunately not been able to hit it very hard at the beginning. We still have a high degree of vaccine hesitancy and vaccine reluctance, and because of that, it's going to just continue to smolder around, and
Well, when we
that's
come back, we got to take a break. But when we come back, we want to talk about the fact that Pfizer has FDA approval. What does that mean? What does that mean for promotions in terms of advertising, and exactly what products exist in Pfizer? We'll be back with Dr. Charles after the break. Welcome back to Face It and Fix It. We're speaking to Dr. Brian Charles, specialist emergency physician. Dr. Charles, before the break, you may not know the business aspect of it, but I will still put it out there. For the Pfizer vaccine now having FDA approval. Now, for sure, I know that means that they can now advertise their product, tell the public what's in the vaccine. But what I would like to know, and I have to do some research, is it that now that they can do that, are they liable in case people may have some injury or possibly death from Pfizer now that we have full FDA approval? Does that change a game changer for Pfizer?
It changes the perspective a little bit. And let me just, even before we go into that, let me just mention to the public, because I think this concerns us quite a bit. Vaccines go through the same rigorous testing as normal medications. And because of the need of to have something to address this pandemic, This is the reason why emergency use authorization was given to the vaccines that are currently approved so that we can start the fight against the pandemic. By no means are these things experimental because thousands of persons would have had the vaccines before emergency use authorization was given. Having said that, like with every other drug, every single other drug, there are going to be some cases whereby there will be some effects which are not desirous. There is no medication that we have that there is no side effects, none whatsoever. And I've been privy to understand that there's some material circulating on social media which speaks to severe effects against the Pfizer vaccine. Yes, this is not unexpected. It is unfortunate that some people have had these effects. It is very unfortunate. But if you compare the number of persons who have had versus the millions, I gotta repeat, millions of people who have had the vaccines and have been safe and have been protecting themselves and their loved ones against serious illness and hospitalization and even death, then you will realize that this risk, though unfortunate, and I repeat, it's unfortunate and we never would like it to happen, the risk, the benefits far outweigh the risk. So I wanted to put that on the table very early so that people understand that it is not that the vaccines are 100% safe. It is the same for every other medicine that we can give. Same for every single one.
And
Now,
I
let's
think
get back.
people,
Yes.
no, I just wanted to agree with you there because remember in the previous show we talked about numbers and realistically the good that the vaccine is doing is outweighing the negative that the vaccine is doing because we would always have, as you said, someone or a few people may have some reactions and things that we don't want. But the vaccine is winning to the point that you're not getting sick. You're not seeing many deaths in certain places. Hospitalization has been reduced in certain countries. And when you do the maths and you see who's in the hospital versus who's not, you do get
Yes.
vaccinated people, yes, but the majority are unvaccinated people. I mean, you ain't rocket science. It's basic mathematics.
Right.
And I'll let you
And
continue.
if I were to, yeah, no, if I even before we get onto the FDA's approval, just continuing on what you just said, as more and more people get vaccinated, more people will be admitted to hospital who have been vaccinated because the pool for which COVID is attacking is going to consist of more vaccinated people. It's not going away. It doesn't mean that the people that we have vaccinated, all of a sudden, their vulnerabilities have gone away. No, the vaccine just reduces that incidence of severe illness, hospitalization, and death. So as we have more and more people who are, as the pandemic goes on, the hospitalizations of the vaccinated people will increase. But it also means that if there is a large pool of unvaccinated people, those persons will also be hospitalized and likely to have severe illness. Now, if we have, for example, in Israel and in the UK, if you look at the statistics speaking to the number of hospitalizations of vaccinated people, and you compare that with 3 months, 6 months, 9 months away, the number of vaccinated people is increasing. But it is not increasing because the vaccine is not working. It is increasing because more and more people are vaccinated, and there's
Okay, wait,
less
wait,
of
wait,
the
wait, wait. Well,
unvaccinated people.
you gotta break that down for me, Dr. Charles, and I'm sure people that right now listening are a little confused. So, I was vaccinated February 1st shot, April 2nd shot. If it is true that you're gonna lose, efficacy, say by December, I'm trying to understand when you said more and more vaccinated people would be in a hospital, but for what? For just
COVID symptoms. Right. So what happens is that as the pool in the population for vaccinated people increases,
Right.
and hence unvaccinated people decreases,
Decreases.
you will, yes, you will start to catch persons who are vaccinated that are going to get, some symptoms
Right.
because there are more of that pool to select from. It is not
Right.
that the
Okay.
vaccine isn't working.
Right. So eventually, vaccinated people can end up back in hospital, not seriously ill, or probably
Correct.
not dying, and
Yes.
but they're not really at a harm to, but they can still spread the virus. So I'm a little confused here.
Right. So the number I was going on to say that the number of in those populations where there's a high number of people who are vaccinated, the
Israel.
number of hospitalizations of the vaccinated people are starting to come up, but the number of deaths and ICU admissions have gone away from COVID because the
Oh,
vaccine
okay.
is
I
working.
got you. I got
Is
you.
that
Just,
making
I
sense?
just wanted you to slow
Right.
it down, break
Yeah.
it down, because if I didn't understand, I'm going to
Yes.
assume that some people, because I don't want people to go like, what's the sense of getting vaccinated if I'm going to end back up in hospital? And you don't mean it in a critical sense, in an ICU sense, or in the
No.
morgue type of thing. What we're
No.
saying is that at some point, if 90% of people are vaccinated, and you can catch it again, you could end back up in hospital, not in a serious way, maybe just to be treated for mild symptoms, or sometimes not hospitalized at all. And that's basically what will happen. Not that you're
Right.
vaccinated and you're going to need ventilators and things like that. So, and because
Correct.
people are asking about vaccinated people, the numbers are going up. And that's what you're talking about. The numbers are going up for people who are catching COVID that are vaccinated, but they're not gravely ill, they're not dying of this disease, and really and truly the vaccine is still the way to go. I just want to clear that
That's
up
correct.
so that people
That's
do not
absolutely correct.
misunderstand. And then let me repeat, the reason for getting the vaccine is to reduce your chances of getting ill and dying. Even if you catch COVID again, remember, it still would not hurt you to the point of not being vaccinated. So we encourage people to get the vaccine. Someone here is asking to Dr. Charles, if a person is allergic to sulfur, can they take any one of the vaccines?
Yes, please, you can. Please, when you go to take your vaccine, just let them know I'm allergic so that they can observe you for the 15 to 30 minutes. But it's absolutely safe. Yes, you can. So I was going to go on very quickly to state about the FDA approval of the Pfizer
Yes.
vaccine. What that means is that now it is fully authorized to be used like any other drug, that there is some autonomy for the persons administering the vaccine. They can give the vaccine now, according to when they think a booster dose is needed. And it also means that Pfizer can now start to advertise for use of its vaccine to combat this disease because it's now used as any other drug. The the liability for any serious illness or effects, adverse effects from administration of the vaccine comes, I do not know, but I'm sure that we will hear that very, very shortly. It is my belief that with FDA approval, and if that goes worldwide, then they will have to take some degree of liability if there is
Yes.
serious adverse effects that can be proven, I repeat, proven to be caused by the vaccine.
Well, I think it was on Saturday, the Prime Minister had a press conference, Saturday or Sunday, or Friday. The press conference, people, which is unfortunate, extracting a little piece of their information and misleading the public. Now, I watched a press conference where the Prime Minister said that there are some countries that are considering assisting someone, a family who might have lost a loved one, in particular breadwinner, from taking a vaccine. They're saying providing it is proven that the government, together with other governments, Canada, England, they're looking at it. And the reason why I think they can take the risk is because they know it's not going to be a lot of people. Start there. She also went on to say that if you die from COVID, there's not going to be a lot of help, minus maybe what we call the welfare system that may then lend some assistance in that regard. And that was very clear to me, but it's unfortunate that someone who clearly had nothing better to do with their time, but a good genius at doing some video editing, edited out what she said and misled the public, and people were a little confused about what the Prime Minister said about accepting liability. She said the government was considering if you die from taking the vaccine, your family, there's a one-off payment, there's some consideration being given there, as well as, but if you die from COVID, then there's nothing. So we do have to take a break. When we come back, we're going to wrap up with you with some final thoughts, and we'll be right back. Welcome back to Face It and Fix It with Dr. Brian Charles, specialist emergency physician. Dr. Charles, in wrapping up, I want to get back a little bit to the children, and particularly Harrison's point. We've never seen these numbers before. What can we tell parents and people who are still hesitant about taking the vaccine? Because we need to still build a protection wall around children under the age of 12, because there's no vaccine for them as yet.
Yeah. I think the point that we can make to the parents is that the virus likes three things: close contact, confined spaces, and crowds. And if you look at the younger population, remember the younger population are the ones that are more, for lack of a better word, free to do these things. And it could be difficult if you do not understand the way the virus spreads, that this could happen. Now, if we use the non-pharmacological methods, masking, sanitizing, and social distancing, that's one way of addressing it. We also need to encourage those that could be vaccinated, the 12 to 18-year-olds in the Pfizer, the 18 for the rest of the population above with Sinopharm and AstraZeneca and Pfizer. If we can protect those younger ones, then we are able to screen them from the seriousness of the disease. Now, if you look at the figures from Harrison's point, you will realize that it is now skewed in the opposite direction. We have a lot more people that are younger that are in Harrison Point, and several children as well. And let's pray to God that none of these children get seriously ill, but we still need to protect them, and we as the adults can do so by acting responsibly. So I think that that's the main thing that we need to tell the parents. I know that there's a lot of the vaccination, but the numbers don't lie. We are not going to cook numbers to try to take the vaccine. We give you the numbers so that you can make that choice for yourself and for your loved
Do we
ones.
have any data on long COVID in children in terms of what we're seeing?
So I have not seen any publications on long COVID in children as yet, and but we keep looking for them. That's another frightful thing, and we have not spoken about this on the show. Maybe we can do so at some point in time. Long COVID can present in people who have not had symptoms of COVID. So you may be asymptomatic and you can, in 3, 6 months, be experiencing symptoms from long COVID. And certainly those persons who have been symptomatic and severely ill are more likely to get long COVID. But we don't have any, I have personally have not seen any data on children with long at this point in time.
And would you like to reinforce some of the things that we see from long COVID in adults? Because I know we spoke about that. We
Sure.
talked about hair loss.
Yeah.
What are we seeing?
Yes, that's right. So remember earlier on in this program, we mentioned that COVID can attack any organ. Because of that, if even in the acute stages you may not present with, respiratory illness like cough and shortness of breath and pneumonia, or heart problems, or even strokes or clotting problems, in the long run, you can present with these simpler things or other things that are affecting the organs which COVID has attacked. So the most common symptoms that we have seen in long COVID are neurological symptoms such as what we call brain fog, which means the inability to concentrate, lapses in memory, disorientation, blackouts, seizures. And then there are other things like, shortness of breath and difficulty in getting your muscles to work. I've had stories of an athlete. There's one athlete in Barbados, actually, who has had tremendous trouble trying to get back into where they were before, because their musculoskeletal system just is not working as it was before. Then there are gastrointestinal problems like anorexia, which is loss of appetite, and then there are persons who have frequent episodes of diarrhea and skin rashes, hair loss. It goes on. The
And
long
let's not
COVID is,
forget erectile
yeah.
dysfunction. I'm sorry, but
Oh,
I
I'm
think
sorry.
that
That's
is a
correct.
major issue, because I figure that maybe if men knew, we would see more men coming forward. And I want to just tell the public that this is not fear mongering. This is
No.
fact mongering, if you want to call it. Fact
Yeah,
mongering is
yeah.
a new word now we're going to put out there. It's not fear mongering, it's fact mongering. And that's what we're
Right.
doing.
And
You're
the
bringing
numbers
the
don't lie.
facts.
The numbers just do not lie. We need to remember that.
Okay, well, I want to thank you, Dr. Charles, and we certainly will take you up on having some further discussions about long COVID in children, and what we hopefully will be able to get some information on that for our next show. And stay safe until we meet again.
Thank you very
Thank
much.
you.
And stay safe. Barbados, be good. Thank you. Stay safe.
Thank you. When we come back, we are going to have Dr. Russell Broome-Webster, the Public Relations Officer for the Barbados Association of Medical Practitioners. And of course, we are going to continue our conversation on COVID-19 when we come back. Welcome back to Face It and Fix It. Our next guest, Dr. Russell Broome-Webster, Public Relations Officer for the Barbados Association of Medical Practitioners, BAMP. Dr. Broome-Webster, welcome.
Hi, good morning. How are you, Joanne?
I am well. Nice to see you. I know we've spoken before on different issues, and nice to see you now in this capacity. We want to ask you a personal question, of course, first, and how are you holding up as a doctor in the face of this pandemic, as well as your colleagues in the association?
Well, I think, like all Barbadians, it's been a difficult time. Certainly, we as physicians feel I think there's some acute issues that affect us even more in terms of being able to engage with our patients. At many points in time, there were challenges in keeping offices open, persons deciding whether they want to continue to practice or not. There's been a lot of difficult decisions in the physician space, and then with the with the healthcare resources being overwhelmed, people moving away from things that they may have done traditionally. So there's been a lot of adaptation which has had to happen in a short space of time. I think because of our training is something that we're capable of doing, but not into a pandemic is not something we would have ever had to do before, and it's been really hard. Certainly, when we see situations like what's happened now, where there's an overwhelming amount of cases, difficulty in terms of the health system keeping up, on the background of a health system that's already been significantly challenged because of the other pandemic, which is really non-communicable diseases like hypertension, diabetes, cardiovascular disease, which has led to significant stress on our staff throughout the polyclinic and the hospital system. Then to add COVID-19 on top of that has been particularly challenging. And I think everyone now, a year and a half in, almost 2 years, is really feeling feeling it at this point in time. And it's one of those things sometimes that we're not able to communicate that well to the public, because what happens in the healthcare settings may seem sometimes behind the scenes. Persons go into the hospital, they come out, they go to the polyclinics, they go to various places for testing or other things that are happening, even vaccination. But in a very real way, that is a very onerous task that has to go on. And even though it's our duty, once the numbers become very big, it really puts a big strain on individuals. And we appreciate that all our colleagues in the healthcare space are really stressed right now. And certainly that's no different from the average Barbadian who's dealing with all the fatigue associated with the pandemic.
Mm-hmm. Well, I certainly, I know a lot of people do support the efforts of the doctors and the nurses and all the healthcare workers. But I will say this, and publicly say, I'm disgusted by some of the comments by the public as it relates to our healthcare workers. In the beginning, we were banging pots and pans and everything, and now it looks like they want to hit you over the head with a pot and pan. And it has changed because they're getting angry, they're not feeling as if they're trusting the doctors that they once used to trust. And you can only bring the facts, the information as you get it, as well as from a professional perspective. But I want to ask you about BAMP's take on the Delta variant with your colleagues. Now we're seeing something that is highly contagious, more so than all of the other variants that we've seen. What is your take on this Delta variant and your colleagues as well?
Yeah, so I would say there's been a lot of robust discussion around it from the time the variant had come about. I mean, BAMP from the very beginning had, we formed a COVID-19 task force with a range of professionals in various specialties in order to try to address the pandemic head on, and have come up with a series of recommendations which have, some been favorable, some not so favorable by the public, and, even private sector and government. But our position has always been that we need to uphold the science and continue to put the facts forward as best as we understand in order to keep Barbados as sustainable as possible. And sustainability is twofold, which is both healthcare and economy working together to give the best opportunity for life, but also quality of life. And that's kind of been the goal of what we've been trying to do, because we feel it personally as physicians as well. That being said, since the Delta variant had raised its head, probably about a month ago, there was some significant recommendations which we had put out about. I mean, and a lot of it isn't new, but just talking about the transmissibility of this variant, the fact that it does seem to be far more transmissible than previously, and a lot of the measures that we used before really needed to be reinforced, as well as the consideration of some restriction of movements, well, not all the time, but intermittently, as kind of a strategic plan in order to address any uptick in cases, which we would have expected, because with Delta is not easy to stop, even in countries that have had great COVID-19 responses. It now seems to be breaking through the wall. So the Swiss cheese model that we talk about all the time with reference to personal responsibilities and shared responsibilities, like restriction of movement, physical distancing, washing your hands, respiratory hygiene, things that we can do at the government level in terms, or policy level, in terms of setting up good quarantine and isolation facilities, fast testing and tracing, which we've always recommended. We should continue to improve the resources at our local lab and have availability of testing as wide as possible, because one of the things that is very challenging is patients have there's in many ways there's siloed locations for testing and vaccinations, and BAMP has always advocated that we would like to be incorporated in those processes as well, in order to scale
I was going to
up.
ask, my next question too, because when you talked about your colleagues being a little overwhelmed and wanting to know if to shut down their practice, like a what to do type of thing, do you have testing at the private offices? For example, I know people are doing the fever checks, and that's fine, but you could be asymptomatic and you don't have a fever. But if you've got the rapid antigen, isn't that something that doctors should be doing as a patient comes and there's a nurse, and as they're waiting to be seen, you do a rapid antigen. It eases your fears somewhat. I mean, I know it's not 100% like the PCR test, but it still gives you a level of information to let you proceed with some ease.
Yes. So it's a very good question, and it seems like a straightforward solution. But with most things, there are always processes involved. I mean, I would say that both the PCR and the rapid antigen test will have their limitations. The rapid antigen is particularly useful in persons who have symptomatic disease. And in a way, as you're saying, that is something that in private offices you could have an opportunity to scale up testing. It's something that we have advocated for significantly. We were even involved in helping to frame some of the guidelines around the rapid antigen testing in Barbados as well, and there was some suggestion that would be rolled out widespread. I still think it's something that we recommend. Is just that obviously there's some checks and balances that need to be there. Mm-hmm. While it's not a hard test to administer, you need guidelines, make sure people understand how to use the test, quality controls. But having testing available as widely as possible right now in the context of the Delta variant is, once we have a reporting system that has a robust ability to report and engage, so that the Ministry of Health and the authorities are notified, and persons may not just be doing these rapid tests in silos on their own, which can be challenging as well. But these are things that have been discussed robustly, and I think we're just.
But don't you think though that even though with the discussion right now, some action, because to have a lot of tests on the island through government, and I do understand that government is going to increase their testing at various pop-up sites, but to me, the key to this, part of it, or should I say part of the puzzle, would be in the testing and even vaccinations being administered by doctors. So if I go to my doctor, I want to test, I'm paying for my visit anyway. I mean, the test could be free because it was being provided by the government of Barbados to spread across the membership in BAMP, then I can't see what the holdup is. But I mean, again, I'm not there in the meetings behind the scenes, but I'm publicly saying this, that we are in a serious situation, and I do know that this government said that there would be red tape would be cut and move, because they have been moving at a good speed. They've got Harrison's Point up and running. They've got all the different sites, and they're making preparations with BAMP and other agencies to prepare for this Delta variant. So yes, kudos. But again, there's more that has to be done. And listening to you, and now I have the opportunity to talk to you, I really feel, and if government is listening, and I know they are, the testing kits should be shared amongst the membership of BAMP, as well as vaccines, maybe not the Pfizer, because of how the mixing components would be, but certainly the simpler ones at the AstraZeneca. But that's just me throwing in my plea. I know that you probably have to explain it in the way you can on behalf of the membership.
No, I mean, your position is not much from what we've been advocating for. Obviously, this decision has to happen at the ministry level, but certainly once the regulatory framework is in place, which is something that I've said we have worked on here to participate in multiple occasions, it seems to be is a reasonable conclusion, and we would love to be able to do more. I think the issue with NC, one of the biggest we have in general, is trust. And it's probably the biggest issue across the world, really, because there's a lot of information out there, and there's changing information. Persons who are the answer movement or have other agendas use that information strictly to try to sway opinions. But certainly, that trust is something that we have as patient. If it is, telling someone of us with reference to diabetes or really bad news, like explaining a complex condition, that's something we do on a day-to-day, and certainly, along with my other healthcare, partners, nurses, pharmacists as well. These are things we do, and patients rely on us to give them information in a personal manner. So translating the discussion about vaccines and actually being able to convert that into giving vaccines as well is something that it has been improvement with some of the hesitancy issues. It won't solve all the problems, because you have a mass vaccination campaign that's necessary in order to get us as close as possible to the highest number possible to de-risk this disease in our population. But I do wholeheartedly, and I think it's something that we have advocated for and ventilated multiple times, not only as a reach out to our patients, but certainly to curb the issues in the pandemic environment.
Okay, well, I remember hearing the president of BAMP saying that the association had made a recommendation of harsh and short measures in terms of controlling the spread. What were some of the recommendations in terms of harsh? At that time, was it a lockdown, but for a shorter period, a complete lockdown of maybe starving the virus so they wouldn't have a host for that period of time?
Yeah, I think more so than the specifics, the general concept of restricting movement is what has been advocated. Obviously, a lot of times you need to nail down and decide what's appropriate depending on what's happening at a particular moment in time. But a lot of that has to do with, there are various things you can do, from shortening the curfew time to, bringing it up to 7, to asking people to work from staying indoors, reducing school activity or workplace activity. But even though these are things that we've outlined in great detail previously, what has to happen a lot of the times is that is appropriate. I think at this time, we are yet at the policy level. There's a general agreement that from time to time, with these upticking cases, that restriction of movement, while not for long periods of time, but for short periods of time, as one of the interventions to help. Now, obviously, widespread vaccination, if we have 10% of people vaccinated and variants stable, that is really the ideal situation. It's probably the gold standard, where they have close to about 90% of their population over the age of 17 vaccinated, They would have had over 3 to 4 thousand cases last few weeks to a month, and only about 2 deaths. Okay, and certainly that's a firm example of vaccines working with relatively low restriction of movable open borders. Their country is about 380 to 400,000 people, which is just about 150,000, maybe 100,000 people more than ours. So it's a good place to look at in terms of making comparisons about how vaccines can really work. But I think there has to be agreement in the context of vaccination rates, while we're still to maintain movement and maintain much to a situation where we have overwhelming cases. I mean, I heard Dr. Charles speaking earlier. I didn't hear all of what he said, but essentially, facilities or isolation facilities can only hold so much at any given time. And then even then, there's problems with transport and moving around when become very, very big. So persons effectively end up being at home for short periods of time, or even engaging with the community, even if they may have a positive test, because the system is not. So you need to take all of that into consideration, because when the healthcare system becomes overwhelmed in an already difficult situation, what happens is difficult to anything. As much as we would like the economy to keep going. I mean, we have situations in Jamaica, Guadeloupe, Tortola, Turks and Caicos right now with, basically effectively Jamaica with about 1,000, close to 1,000 cases today and 20 deaths over 4 hours, where they have no space in the inn, no oxygen in the inn. And that is the current one of our brothers and sisters in CARICOM because of the Delta. So while we are in a position that is still not that bad, you have to take the time to make urgent interventions, which are actually going to give you great benefit and investment in the long run.
But when
prevention is better than cure.
True, but when we look at it from a psychological standpoint here, in the beginning, I think it was all fine and dandy. We were on lockdown. That was last year. Happened again. If you do it again because, people feeling a little edgy, personalities start to push back a little bit. Because for me, personally, you box human beings in a time frame. They actually overdo it in that time frame. So, example, man has a girlfriend. He probably shouldn't have the girlfriend, but he has that girlfriend. And he wants to see her, so he sees her at lunchtime as opposed to nighttime. Guys want to drink. They know they can't party, so they start drinking at 10 o'clock in the morning to make up for whatever. So when people are boxed in, they're actually overdoing it because they're tired. So when they hear, shoot, another curfew, they go like, boy, we gotta go and get something to drink. We gotta get home. So I find that even though we're trying to help and our intentions are good, it actually can have an opposite effect because human beings, when they're boxed in, behave very different.
Yeah, so I agree with that totally. If you look at the persons, for example, that are adherent with hypertensive medication or asthma medication or any instructions that we give them on a day-to-day basis, they're always going to be there with instruction, following rules, and behavior is something that we always have to take into consideration, and that's why communication is really important. So one of the big uncertainties with COVID, which has been really taxing on persons' mental, and to the point that you made, is that a lot of times these apparent measures or lockdowns or whatever testing procedures may come in place, there hasn't been enough ventilation, education, and communication around the issues, and in many cases you don't have a clear long-term plan that you know what's going to happen. So the communication always can be improved, and if we have our plan is to have a long structured response to COVID-19, as I heard mentioned in the press conference the other about the marathon and type of thing. The reality is that you still have to be strategic in everything that you do. Times in a race where you need to pick up. There are going to be times where you need to slow down a little bit. There are going to be times where you need to go and grab some water. But if you're strategic, you can get to the end appropriately. And we need to communicate that to the public.
To the public.
So, yeah, I'm in no way, and I think no one that you talk to from a medical standpoint favors lockdowns. Nobody wants to have, and I want to make that very clear to the public. Nobody wants to have to shut down the country. Um, but you want to be in a position where you're testing, you're contact tracing, you're border control, adhering to the various public health. People getting vaccinated at a high rate,
Yeah.
understanding the consequences and the benefits and risks are at a level that you can make significant inroads without having to do that. But when you're, what should Jamaica do right now? In a country where, yeah,
Let's take a break and talk about Jamaica when we
yeah,
do come back. We got to take a quick
yeah.
break and we'll be right back. Welcome back to Face It and Fix It. We are speaking to Dr. Russell Broome-Webster, PRO for BAMP. Dr. Webster, before the break, Broome-Webster, before the break, you were talking about what should happen in Jamaica.
No, I just like to pose questions to the audience and to the public as well. I mean, I think there's, as I keep mentioning, there's always a fine balance, and certainly we're not in favor of restricting movement so severely because we recognize the significant mental health consequences on the populace, and things like alcohol use in particular, a topic which is very common in our population, has gone up quite significantly in the pandemic. Things like domestic violence, certainly crime in many places is something that's taken off. And these are the difficult decisions that you're always weighing. And when you talk about public health, COVID-19, when we make these recommendations, we're taking into consideration both sides of the coin at all times, and understanding that you have to really make hard decisions. It's not easy. But when you can get to a situation where our healthcare system is overwhelmed, that's the point where that's the point we're not get to, because once we reach that stage, then the only decisions to be made then become very, very difficult ones where there are no real winners.
Well,
Very, very
I
difficult.
want to ask you
Yeah.
about that because that's an
Yeah.
important point. We know we've seen what happened in Italy.
Yeah.
Healthcare system became overwhelmed. Doctors had to make a decision. We already have a healthcare system that, it needs some assistance. I know QEH has some new equipment and making some changes, but they're not quite there yet. So when you're having an increase in COVID patients, that could possibly then impact your patients with comorbidities. And then there's nowhere to put them. Harrison's Point is overwhelmed. This place is overwhelmed. Somebody coming in with COVID. I mean, then you got to make decisions. Now, somebody's going to say, I'm not vaccinated, but you got to save my life. And then somebody over here say, my mom is a diabetic. She's been waiting here for 3 hours. And then you got other diabetics. How do you choose? Because there are people out there saying, come on, unvaccinated people. If you don't want to vaccinate, you got to try your best to protect yourself. But do you think that we could, and I said could, get to a point in this country where we could become an Italy, where we may have to make decisions because we don't have enough oxygen, we don't have enough beds, And the simple remedy could have been just for us to take a vaccine or at least social distance and follow all of the other protocols. Do you think we can get there?
I mean, first of all, I would say we're not Italy, so it makes us vulnerable. So I'll make that point first and foremost. Remember that healthcare systems that were crushed by COVID initially were really robust healthcare systems. I mean, Northern Italy would be considered one of the best healthcare systems in the world, along with the USA, and they have very high rates of personnel to ICU beds. So at a baseline, developing countries have a very difficult, being countries or small island developing states, as they would call it, we have a very difficult situation. We're seeing it in Latin America. We're seeing it throughout the entire PAH region, which is basically siege from COVID. So we should, yes, the answer is that there's always a chance that we could get to that stage. Fortunately for Barbados, the things that have been put in place before with the isolation facilities, previous in terms of restriction of movement, we now have an improving vaccination rate, which we need to accelerate again with the addition of Pfizer and Sinopharm to our protocols. We've been in a slightly different position, and in some cases praised. But certainly we are still very vulnerable. And the very important part to take into consideration is that as systems become overwhelmed, the COVID cases become just a part of the problem. The entire healthcare system then becomes compromised, with the persons who would have diabetes, people who would have ischemic heart disease and heart attacks and so on, coming to hospitals, for example, and not being able to receive treatment or care or even get appropriate surgery for simple interventions. If you don't have, for example, any oxygen, how can you put somebody to sleep without oxygen for a basic intervention? So there's also the issue of excess mortality, which certainly makes the problem even worse once the system becomes overwhelmed. So it's even more incentive for us to participate in suppressing COVID, because it's not just about control of COVID, it's maintaining our entire healthcare system as a whole, which is an underpinning of the entire society. Without that, there's a significant economic fallout that would occur.
And can you imagine, and this is definitely to the public, when you go to QEH, yes, they try their best. There are excellent doctors at the Queen Elizabeth Hospital, but we do know that there's sometimes a long wait at A&E. So imagine now, pre-COVID, that's been the case where there's been a long wait. Imagine now in an environment where people don't adhere or take a vaccine or don't practice proper protocols, what that could be like instead of the accident and emergency, which, by the way, I know that they screen and do testing for COVID before, but that's still time consuming. When something could be wrong with you, you may not be presenting symptoms that are visible when you're triaged, but something could be happening. But because the system is so overwhelmed, it takes some time to do those tests, then to be fully treated. I'm not saying that they don't deal with emergencies, they do, whether or not, you get a rapid antigen, but the doctors will certainly see you, from what I understand. So I don't want that to be taken as you have to get a COVID test before you're seen. But I know screening takes place at the QEH before you can actually go upstairs, I should say, onto a ward. Is that correct in my assumption? I would imagine that that's what they do.
Yeah, that's correct. I mean, they have very formal screening protocols, and I think they've been doing their best to try to manage the situation. But certainly, like everyone else at the QEH, there are significant challenges with staff on the go. They're not necessarily new doctors or new personnel that can do all of these things that just appear out the blue. I mean, we did have some support from the Ghanaian nurses who would have come in, from the Cuban nurses as well, and from Cuba in terms of healthcare professionals, but you can't just people who can run ventilators out of the blue. It's not something. It's a very specialized skill. So all of those specialized, and when you've been already stretched managing the day-to-day activities, then you have to then be repurposed to isolation facility. You are going to have significant staff shortages and significant challenges, and And right now, the team at the QEH is certainly trying their best, but we have to appreciate that they're all very, very tired now, and working as hard as they can, but really tired mentally, physically, and probably emotionally as well.
I know. I want to thank you. Got to leave it right there, Dr. Russica. We're out of time, but I thank you so much, and I'm hoping to bring you back on the show because we need to talk more about the NCDs in this country and have a different conversation because it's not all about COVID. And I want to thank you so much. Thank you for coming.
Thank you. Thank you very much.
That was Dr. Russell Broome-Webster, PRO for BAMP. Up next, the Honorable Indar Weir. He is the Minister of Agriculture and Food Security. We want to talk to him about what's happening in the country and how has the pandemic impacted the agricultural industry. We'll be back after the break. Welcome back to Face It and Fix It. My next guest is none other than the Honorable Indar Weir, Minister of Agriculture and Food Security. Minister, welcome to our program. Thank you very much for gracing us with your presence because I know your time somewhat is limited, ours too. So I'll just let you know that we do have about 25 minutes and I know you can get a lot in then. So Minister, I just want to welcome you first. Thank you for coming. And I want to get straight into the first question, and everybody wants to know, what is the current state in the country's agricultural sector, especially in light of the COVID-19 pandemic? Can you generalize it? Because I know it's a loaded question, but what's the current state of our agricultural sector right now?
Well, first of all, Jayan, thanks for having me. Good morning to all Barbadians near and far. The agriculture sector in Barbados, we are stabilizing. There are several challenges that would have confronted us, given the fact that there's a lot to be done in order for us to be able to put agriculture where it really needs to be in the 21st century requirement. We've had several issues with prolonged droughts due to climate change, issues with flooding, when we get excess rainfall, and we have to be able to strike a balance. This is something that I've been speaking about for a long while. So we've now started the process of putting in the water harvesting at River in St. Philip, and we'll be also going to Spring Hall in St. Lucie. There's also one at Haggots. Haggots is where Soil Conservation Unit is located, where we're putting back the national orchard there, so that Barbadians can get access to local fruits. And then we are also doing the water harvesting project and the Leirs project at Leirs as well. So with those, then we will seek to ramp up production and make sure that there's consistency in supply through the provision of water in the drought period for the farmers who otherwise would either have to pay as high as 4.66 per cubic meter if they have Barbados Water Authority water, or those who are on the irrigation systems about 66 cents per cubic meter if it is the BADMC. So we are trying to bring about an equitable distribution to all and make sure everybody is on the same playing field. As far as crop production is concerned, because of the COVID situation, many farmers would have scaled back some of their production. You do recall when we were in the last lockdown, the BADMC was purchasing the supplies from the farmers, but we really didn't have the capacity to take all of it. So some of the farmers were struggling because we did have some gluts in certain areas. And these are the things we are trying now to work on to make sure that we can fix those things and give the farmers a fair chance at being able to get access to markets when they produce.
Wow, that's a lot. So, Minister, everyone is talking about COVID-19, eyes on the Ministry of Health. We also have eyes on education and other ministries. And I want Barbadians to understand, and I'm pretty much sure that they do. Your ministry, by far, in my opinion, is a little bit more important than the others, and I'll say this. I'll say why. Not everyone will catch COVID-19. Not everyone will go to the hospital on a regular basis, but everybody has to eat. So the Ministry of Agriculture is a very, very, very important ministry. And I said that to say this. They're concerned about the price of food because we all have to eat. What is government doing about maybe securing more local produce, reducing the price of imports? I know that we are faced with a lot of outside forces because of COVID-19 and the imports and transportation, etc. But I also know that government has assisted farmers in a way of subsidy by extending the subsidy to a feed company. Are there any other things that government will be doing in order to assist us with the rise in food prices, sir, that a lot of us find it very difficult to shop in the supermarket these days?
Well, interesting question, Joyanne. The government, yes, did provide a price support for the livestock subsector. And this is important because we don't have a large livestock subsector. And we want to make sure that people can still get access to local pork, poultry, dairy products, and of course our local black belly lamb. We took a decision at Cabinet to not only provide the price support for the farmers, and I want the narrative to be correct. I've said this already also. This price support is for the farmers. It is not for the feed company. The feed company will benefit. It's almost like you have a headache or you have a thirst. I prefer to say a thirst. And you want something to drink to quench the thirst. So you drink some water. It is the water that you drink, but it's the thirst that you're dealing with. And it's the same thing here. Our reality is that we want to help the small farmers. But in order to help the small farmers, we have to obviously give Pinnacle the benefit of the help, which is really where we're saving the farmers from having to pay Pinnacle the increase in costs. So the farmers are the beneficiaries, really. And that has to be made clear. Is that we have to increase in Barbados. I spoke to it earlier, and this is crop production I'm talking about. But for us to do that and reach consistency, for too long we in Barbados have been dealing with issues about water harvesting. I mean, every call-in program that I've listened to, you would have heard callers calling to make recommendations about harvesting runoff water. And we are able now to capture our storm water and provide this water for the farmers in the drought periods. That will help us to get to increase. Once there's increase in production, the next obvious thing will happen, prices will fall. Because once there's an increase in supply, equally that outstrips demand, then prices fall. If you have a situation where demand is outstripping supply, prices would always increase. And this is where we are trying to deal with this problem of increased prices as far as our local production is concerned. I view that there are external forces that will impact prices, and those we will have to look at them one by one. The Cabinet has instructed me to go away and look at options available to farmers so that we don't have to continue to look at things like price support for livestock subsector, but we can look at other things. We certainly can look at tariffs to make sure that we can allow for feed to be imported into Barbados as well at a favorable price to the farmers. That way, government does not have to put in the price support. And then we can look at options in terms of other entrants coming into the market to produce feed locally. We have to look at other options available to the farmers in terms of cost of water and those kind of things. So there are several options available to us, and we are looking at them. I will present a report to the Cabinet of Barbados where that is concerned. But that is for livestock. We still have to look at crop production. We got to look at drought-resistant crops as well. And we are currently talking to the Chinese ambassador. I had a meeting this morning, and we will continue that conversation so we can set up some greenhouses to be able then to introduce technology on a large scale in agriculture, doing hydroponic farming and looking at those crops that we can target so that we can have consistency in supply with those. And then we are looking at putting in a pack house in Barbados where farmers can sell to the pack house. You do recall during the shutdown when farmers were going to BADMC, but BADMC didn't have the capacity to be able to take all the produce from the farmers. We're actually looking at a pack house system now that would have scale so that we can literally allow farmers to be able to sell on a contract basis to the pack house, and then look at how we can provision for the tourism season when tourism really comes back.
Okay. A couple of days ago, you had a press conference to address the African swine fever, and it's not here in Barbados, but you were proactive, making sure that we were all sensitized, in particular pig farmers, as to what it is and what we have to look for. Now, I listened to the press conference, and I understand that it does not pass from pig to human, even if the pig was infected by this African swine fever. But my question to you, how would we know if a backyard farmer who is invested in a pig or two sells the pork that the pig died from the African swine fever? How can we minimize that? How can we encourage them to bring the pigs to the abattoir? Because we know that there is some level of backyard farming and slaughtering. But if you tell me that having African swine flu, and I just bought 2 pigs, and if they died, it don't hurt the public if they eat it, a man may want back his money, and he may look to sell that. How can we minimize that from happening?
Well, you know, we never ever have perfection in anything. The reality of it is this: we are in a mapping of all of the pig farms in Barbados, both commercial and what we call hobbyist farms. And the backyard farms will fall into the hobbyist category. We are working with the stakeholders to identify all of the backyard farms that we have in Barbados because we are targeting them first. Most of the slaughtering is done at the slaughterhouses, either at Southern Meats or at 6 Roads. And we are acutely aware of the fact that there may be some that are still taking place in backyards, but not on a large scale. But to answer your question, if a farmer has a pig or 2 that dies from swine fever, and he chooses to be so dishonest to sell that meat to the public, really and truly, who's he selling it to? He would have to be selling it to the people in his neighborhood. And that's the reason why we are putting out the public service announcements to all Barbadians to make them aware of these things and to help them to be able to determine who they're going to purchase from and what are the things they need to look out for when they're purchasing pork. But I want to say to the public of Barbados that our way still from getting African swine fever in Barbados is in the Dominican Republic. The entire region is sensitizing their farmers about the impact of African swine fever. All borders are on high alert. So, in order for us to get it here, it would mean that it had to escape through on the borders. And we're hoping that everybody would do as they're requested to do to make sure that we put the biosecurity measures in place to protect our borders and protect our farms. That being the case, then we are able to mitigate against having it come to Barbados. Purpose of the press conference we had was to sensitize Barbadians to what is happening, to create that awareness among Barbadians, and then get the buy-in from them so that we can get full support when we are going through with the measures that we're putting in place. This morning, when I met with the technical team at the ministry, we looked at how far we are in terms of getting messages out, and the messaging has already begun. We are doing the recordings with public affairs, and then we are also reaching out to those backyard farmers to make sure that we can find them and do the necessary things to help protect them, because we recognize that a fellow that is keeping 2 pigs is doing so to supplement his income or may not have an income at all.
So you're saying that if people, let's just say that if people try to smuggle in bacon, pork, and don't get the necessary license, for example, and that meat happens to be full with the African swine fever, it can get into the garbage, get onto your farm, and possibly get onto the island like this, like in that form.
Definitely, and that's why we're asking Barbadians not to smuggle in any pork products. We are really pleading to Barbadians to take this thing seriously if we're going to protect our local farmers and protect this country from an outbreak. Barbados will not be able to withstand an outbreak of African swine fever because we are small, and the movement between people from farm to farm will be kind of difficult to control. But we are asking farmers to put the biosecurity measures in place. So you can't come on my farm and I can't come on yours. That kind of approach we're going to have to take. But this also comes down to Barbadians participating and playing their part in protecting this island from any African swine fever entering by smuggling pork products into this country. Having said that, though, we are beefing up our security at the airport and our surveillance. You will see signs going up at both ports of entry, and you would also see that there will be a presence at the airport so that when people come into Barbados, customs will be on high alert as well. Immigration has already had a meeting with the Minister of Tourism and International Transport, and we are making the adjustments to the ED card so that when you complete your ED card, the onus is on you to tell the truth in terms of where you were within the last 7 days before arriving in Barbados. And if it is that you were on a farm, it is for you to say so. But if you don't say so, you don't declare that, and when we check, we find out otherwise, then it becomes an issue where you'll be dealt with accordingly. So the reality of it is for Barbadians to play their part by not smuggling import products. We would deal with the commercial aspects of it.
Well, if I may, Minister, add my little 2 cents in the messaging. Personally, I think you just got to tell Bajans, if you do that, there'll be no sauce on a Saturday and no hams for Christmas, because take away a man's sauce and his ham for Christmas, you got problems. So for me, that's all I would tell them, and that's true because it happens so quickly.
Yes.
This African swine fever, and it kills them very fast, so much so that you have to even put down the pigs to eliminate the suffering that they may go through.
That's
So,
correct.
Bajans, we can be back right after the break, more with Minister Indar Weir on where we are with agriculture in this country. We'll be back. Welcome back to Face It and Fix It. We are speaking with the Honorable Indar Weir, Minister of Agriculture and Food Security. Minister, we don't have a lot of time, but we do have a WhatsApp, a couple of them, but we'll read this one. If they can put it back up on the screen, directed to you about eggs. And there was another question someone made reference to that I will get back to. They said, good day, last Friday morning, I purchased some chicken products. By the evening, the prices went up by $2. 30 eggs have gone up by $3. I am curious to know when this government subsidy is introduced, will prices be reduced for the 3-month period and then increase after the 3-month period? How will that help run along? And before you answer, Minister, before you all had that town hall meeting and after you had, we had seen that the government had stopped the subsidy to put it back on, chickens went up as much as $30 in that short space of time. Can we see a reduction? Because I know you mentioned when food prices go up, you don't normally see things going back down. But will we see a reduction now that you've supported the farmers yet again?
Well, yes, thanks for the question, and I want to thank the person that posed the question on WhatsApp. I met with all the stakeholders. We have stakeholders meetings before I speak to the public, so that we will all be on the same page and there will be no contradicting of each other when we speak. I made it very clear to the poultry producers as well as all the livestock farmers that we expect to see prices going back down with the price support that is put in place. And I also spoke with the feed supplier, the sole manufacturer we have in Barbados. They had proposed a 26% increase in the price of feed. We being able to negotiate that down to 11%. In some instances, the increase will be less than 11% because 11% is the average. And we are better off now than we were at the time when that person purchased those eggs. So I'm confident that the prices should go back down. But I have to say this to you because this is really a case where you find in microeconomics that prices are always flexible when they go up. Biggest problem we face is how do we get them back down, and the economists refer to it as being sticky coming down. That is because people invariably get into all kinds of excuses for not bringing back down prices. Now, the reason why I met with the stakeholders is because I wanted everybody to be absolutely clear that this is a case where we are actually supporting the farmers. And so by extension, I expect the consumers of Barbados to benefit from it. That is the reason why we're here. And then we're looking at other options to continue to support the farmers because it cannot be price support. It has to be by way of bringing operating costs down so that you will help the farmers to reduce their cost of inputs, reduce the cost of operating, and by extension, reduce the cost of the final product to the consumer.
Wow, because as I told you earlier, we are a little surprised at the food prices, and people say, well, shop with someone else, but that's easy for people who have transportation that can drive around and look for the best prices. But when you can only do a one-stop shop, you know, it becomes difficult. Minister, I know you're also in charge of not just the food security, the vending in Bridgetown and so on and so forth. We wouldn't go into it too deep because we do have only about 2-3 minutes. But I just wanted the public to be aware, because I don't think they are fully aware. The Ministry of Agriculture in this country, it's not about just vegetables, it's about the meat, all the food that we eat, as well as vending in Bridgetown. And that also falls under the Ministry of Agriculture. And Minister, as I know you know, that there'll be some new shops coming on stream for your vendors. Any message you want to say to them, and some closing words to the public? I want to give you this opportunity, about 2 minutes, 3 minutes if you like, to have some final remarks, to speak to your vendors and speak to your farmers. What message would this minister want to give?
Well, first of all, let me thank you for giving me the opportunity to be able to speak to the vendors and farmers. A lot of people perhaps don't realize that all the public markets fall under the Ministry of Agriculture and Food Security. And that vending as a whole is something that we've been supporting and making sure that we can anchor our vendors as well. I've had numerous requests from people who believe that the stalls that they're seeing going up in Fairchild Street are stalls that are available to the general public. And so I've had to explain to all Barbadians that those stalls, first and foremost, are there to give the vendors who are at Fairchild Street a better environment and to improve the aesthetics around that area. And so the first priority will be to those vendors who are already there, who are legally there. And then the other thing is we are looking to open up more vending zones in Barbados with the support of the Minister of Commerce and Small Business. He will be bringing a vending bill to Parliament so that Barbadians then can get an opportunity to enter more vending zones as well and have facilities of similar type to Fairchild Street right across the country for our vendors, giving them a chance to be able to become business people, but at the same time, opportunity to earn a living rather than rely on employment, which really and truly is very difficult at this point in time. The Fairchild Street Market is going to be completely refurbished, and once the attachment is finished, we should start to move in the vendors in there. We're going to start with the food and beverage vendors, and then we will clear the front for phase 2, where we would then prepare a similar type environment for those who are doing fruits and vegetables. And I am looking at a full overall refurbishment program for public markets as well, so that we can create more opportunities within the public markets for those vendors. As to our farmers, as I said earlier, we are putting our money where our mouth is, and we have invested $5.9 million in providing catchment areas or reservoirs for our farmers to be able to have water supply, reducing the cost of water and giving us a consistent supply of water to our farmers during the drought period as well. Equally capturing water so that we don't continue to get the type of flooding that we are getting. And then through the feed program, we're continuing to train farmers to bring new entrants into the market, to make sure we develop farmers to use technology as well. And we are also maintaining our food supply. You know, you said earlier about the importance of the Ministry of Agriculture and Food Security. And I wish to give Barbadians the assurance that we have had gluts, not shortages, which means that the ministry has been on top of its game each and every time we went into a shutdown, each and every time we were challenged. We maintained our food supply, and therefore Barbadians had security when it came to being able to access fruits and vegetables, local vegetables, local produce, local meat. We have been able to continue that, and even after St. Vincent, which supplies a lot of the ground provisions that Barbadians use, had the volcanic eruption, we were still able to continue to supply Barbadians with locally grown produce. Sweet potato, for example, we've been consistently supplying. So the ministry really and truly has been on the front foot in making sure that Barbadians can continue to get their supply. And I want to thank all of the local farmers. We are giving them support. We will continue to give them support. They have their challenge. We're working through them. Each and every time we meet with them, we try to correct some of the things that they are experiencing to make sure that they are better off as well. Because I recognize that all we in this together, and I'm working closely with all stakeholders, livestock, crop production, sugar, all stakeholders. And just to let you know as well that the Met Office is doing a fantastic job in keeping us informed. And the Met Office also falls under the Ministry of Agriculture and Food Security.
Oh, okay. Well, Minister, I want to thank you. I know that it's not a lot of time, but we would like to publicly extend an invitation to you once again for a full 2-hour show, so you can explain a little bit more about food security. It's the most important ministry. All of them are important, but we all need to eat. And all eyes on you, Minister, when it comes to the food prices and the farmers, etc. So I want to thank you so much for joining us, Minister. And hopefully we will hear you sooner rather than later on our show to discuss some more agricultural issues for a full 2 hours. Thank you, sir. Thank you.
Thank you, Jaya.
Thank you. Well, we're just about out of time. I want to thank everyone so much. This has been Face It and Fix It. I'm Joanne Haigh. Until, God bless.